July is recognized by the UNESWA Mental Health Society as the Minority Mental Health Month. This is the part where we have the conversation on when we speak of mental health. Yes, there has been a subject around inclusivity, but there are people that will still live behind. And I am now joined by Nonhlanhla Dlamini, who is chairperson of the UNESWA Mental Health Society, to speak to us a bit more on the subject, just to educate us on why issues of mental health we do need to be inclusive. Nkosi, a very good morning to you. How are you feeling this morning?
I'm very well, thank you, and thank you for having me in such a great show. I'm happy to be here.
Fair enough. We're glad that you could make time for us this morning. So, the UNESWA Mental Health Society is recognizing July as the Minority Mental Health Month. Fill us in on who exactly is a minority and why this conversation matters, given the context of Eswatini.
Well, can we not talk about statistics? Because minority is usually associated with the people who are less included in conversations.
Yeah.
But in Eswatini, let us focus on people living with disabilities, both mentally and physically, or both. People living with HIV, people who are survivors of gender-based violence and abuse, people who are basically caregivers to these people, and also young people, children, and also the old people. Because take, for instance, I'll make an example with a young person living with HIV in a rural community. This person is facing a lot of vulnerabilities at the same time. We have stigma, we have what is this thing called unemployment. We also have isolation. The person will isolate themselves. They also have financial hardships. Probably they dropped out of school and they feel like life is happening all at once. That increases the risk of developing depression, anxiety, substance use disorders, as well as psychological distress, which can lead to suicide, can lead to risky behaviors. And we feel that we need to talk to these key populations because their mental health is also at stake and they need to be included in the conversation of mental health as we move along.
The challenges that you have touched on, from discrimination to the stigma, how do you think they affect the mental well-being of somebody who is considered to be part of the minority group?
Basically, when we talk about a person who is, how can I put this? Can I put it in an example?
Sure.
Let's talk about a survivor of gender-based violence. I need a minute. Scratch that. Let's talk about a young person who is facing unemployment, who is facing all these factors and is a survivor of gender-based violence. They need to let out what they have been going through. They need to talk about it. And in mental health, we say that a problem shared is a problem half solved. So we need to create spaces where they can talk and they can let themselves breathe.
Express themselves.
Express themselves. Because if they don't do that, depression creeps in. If they don't do that, anxiety creeps in. If they don't do that, negative coping strategies creep in. They tend to get into drugs. They tend to go into alcohol for a break, if I can put it that way. And they also tend to repeat the cycles, which basically put them in the problem from the get-go.
So if I'm already somebody who's considered to be part of the minority group, say, for instance, I'm struggling with a particular disease, and already that puts me in a position where I'm bottling things up. It's very difficult to speak about it to Nonhlanhla because of the discrimination or the stigma again. Why do you think it's very important for these individuals to speak up, especially them? I mean, they're dealing with two problems at once already. But why is it that it's very important that they reach out and, seek help in terms of mental support?
Can I take it from a perspective of two different... First, we need them to speak up in order to break the stigma and this discrimination, because from a point of view of understanding comes acceptance. When a person understands what this person is going through, they will then tend to understand that their path and their journey is very difficult, and they may actually change the stereotypes which are associated with thinking about mental health as sifo sebelungu, or mental health as being something that happens overseas, but it actually happens in our country. So if you break out, if you speak to your family, to your friend, they then tend to understand this is not just something that happens in movies, it happens here as well, and they also get to open up their own views. Go to, oh, I was looking at it like this, but now it is like this. Then on the side of seeking professional help, it then allows the community to help these people to access services whereby they can actually get professional help to prevent maybe them falling into a crisis, mental health crisis, if I can put it that way. So it goes two ways. For us to break stigma and discrimination, this person, by opening up, they actually allow us to live in their world, to understand what they go through, to understand what they think, to also understand how they are actually looking at themselves when they look at the mirror.
Yeah.
Then we can actually say we can be a supportive, we can be supportive to this person in their needs.
Yeah, I understand that these are individuals that have to take priority in this conversation, but they're often the type of people that face exclusion. They do face isolation. They face emotional exhaustion. How significant is, I want to ask on the part of parents and caregivers of children with disabilities, or the people around people living with disabilities that are part of the minority group. How significant is caregiver mental health, and is it rather a conversation that you would say is receiving enough attention countrywide? Just relax.
Well, I would say it is not.
Okay.
Because the person taking care of a person with disabilities, say, for example, mental disabilities, they experience burnout, caregiver burnout. They also have financial struggles because they need to take care of this person financially. They also have careers, what is this thing called? They have to pause their careers in order to take care of this person. They also have to be there 24/7, meaning that they are also isolating themselves from people, from friends. They don't get a break, if I can put it that way. So their mental health also takes a strike because they feel frustrated. They can have anger outbursts, or they can also feel like their life it's at a standstill point and they're not progressing, or there's nothing to look forward to in life. As people, we need to have that thing that says we're growing, we're moving forward, we're everything. So as a caregiver, you're just there for this person 24/7. There's no outlet for you, there's no fun, there's no anything. And seeing a person going through difficult phases in health, it's not nice.
It takes a toll on you.
It takes a toll on you, and you're seeing this person every day. So we need to have programs like caring for carers, if I can put it that way, who cares for the caregivers, who takes care of what they need, their mental health, who gives them a break. They need that, but they cannot have that because they have to stay with this person 24/7. If it's not 24/7, that small gap or break that they get, they need to attend to urgent issues that need their attention at that particular time. We need to look at it from a perspective of, if you take care of the caregiver's mental health, the caregiver will take care of this person in a very holistic way, because nabo, their needs are met, and keep frustrations towards this person they're caring for.
Yeah. As for the caregiver themselves, do they ever recognize they are at a point where their mental well-being needs, looking into, or do they feel like I can take care of her, I'm just, being strong, doing my best? But do they ever feel the point to know, what are some of the symptoms or signs in that aspect?
Well, I cannot say in full confidence if they see or if they do not see. But then there are some things that actually kind of like become barriers to them actually acknowledging and accepting that I need help. Because we have guilt, we have expectations, and we have familial ties. So utathi lo muntu nakathi yathi nami ngidinga lusito athi lona ngishiyela bani, guilt tripping, right? Expectations, families expect mothers to take care of their children. Nakathi make nami I need to go and do my things. It seems as if like it's selfish, and smelling a bit we are sacrifice time and again. So those things become barriers, but then burnout happens to everybody. Lo sebentako, lo ngumfundi, lo gulago and nalo nakekela lo gulago. And it's high time whereby we get to understand from the perspective of the caregiver lokuthi nakathi ucela break. It's not because you're selfish, it's not because sofuna kuyekelela, it's because naye ufuna kunakekela le yakhe impilo, their own mental health needs as well. Lokuthi naye akashaywe ngumoya. In terms of signs and symptoms, clinically, tabala we burnout, whereby you feel frustrated, anger, so irrational mood, so and also you then that's one part. Another one, utaba withdrawn abe said persistent sadness loku lead to depression, abe depressed naye angasafuni kubona abantu avele nje sale ati belitlisha in a way of ukuthi sofuna kuti eraser empilweni, because so tibona vele a caged la kakhona unakekela those person nothing more nothing less.
How do we distinguish ukuthi lo muntu mhlambe is then at a point of excuse me kule withdrawal showing signs, or laba lesibati ukuthi bangemalona? How worried should we be about them? Because mhlambe besihlale sicoca Nonhlanhla, then maybe the academic pressure came on, the family pressure came on, the financial stress came on. So now I want to distance myself because she's carrying on, or she's at least showing the signs of being a loner now. Should we be worried about people who constantly just want to be by themselves? Or that there's a level of that, but also there's a concerning part about that?
Well, yeah, that's a very tricky one. Bengaglistela ema symptoms at DSM, how do we classify a person who has a major depressive disorder? But then I think that would be boring because a lot of technical terms. But to simplify it, it's just that this person has to present with 5 or more symptoms. Kushintsha appetite, kushintsha sleeping pattern, either solala kakhulu noma akasalali, insomnia akasalali at all. Lose their interest in things that they got tons of before, or experience a persistent sadness or low mood for most of the day, for at least for majority of the day, for at least 2 or 3 times per week. And then the 5th one, it's not coming to me. Unema ideas of ending it all, suicide ideation, if I can put it that way. So unako lokucabanga ukuthi yathi nangafa ngaba ngcono, or rather solahle lithemba empilweni kuthi nje kude lo sekhamba kahle. So basically that would distinguish a loner from a person lesisimsola ukuthi sekunedinkinga.
Okay.
So a loner can be a person nje would prefer ukuthi abe yedwana. But once umuntu waqala washintsha simathi angumuntu lo bubbly, angumuntu lo thanda kuphuma, especially in the university space, we know our classmates, we know a person lo thanda kuphuma, lo thanda kukhuluma. So quiet, so withdrawn. Now umnaka solala kakhulu, akasakhulumi nebangani bakhe, and so khuluma into mfuthe ukuthi yathi impilo yathi shame impilo ngathi ayisebenzi, yathi umuntu nakangafa ngaba ngcono. That's a red flag. And usually gasayikhi sithi waze waqala tenkhulumo ukuthi yathi umuntu nakangafa ngenelela, because suicide is a psychiatric emergency. Sithi thina simix ICU fairly. It's a critical condition.
Right, back to the minority mental health. There's people living with disabilities and they are caregivers as well. I want to ask Lugutsi, how does the lack of or the limitation in terms of rehabilitation, how does it affect their mental being? Or I'm a little undereducated on such a topic. Should it get to a point saying figure late? How do you think that affects their mental well-being?
Well, one thing that I can actually comment on is that people think of rehabilitation only from the physical aspect. Physio, say for example, someone was involved in a car accident, how do you walk again because they got hurt maybe at Dinyawen. But Nagasaki, we do have a rehabilitation. If we had a student, for example, a withdraw from school because Begmele Abe admitted la psych for a psychosis or a depression incident, Melesim rehabilitated back into school. That is what rehabilitation basically speaks to. We need to take this person back to the community with the disability and all. Back to the community and abe accepted and akhone ku engage in everything that bega engage agiyo before. If bega attend my meetings, aqhubeka attend my meetings. If bega participate at church, aqhubeka participate at church. But then kunale misconception yale rehabilitation, if I can put it that way. They look at it from the physical aspect only. They can actually face isolation, stigma, due to stigma and discrimination. But they isolate, reach out because they don't even know what services, where can they get them. Rehabilitator back into their communities.
Yeah.
And also the caregivers themselves can be frustrated because they do want to help, but financially they cannot, because you can go we are private, you can go to the psychiatric rehabilitation, the psychiatric national hospital. But how do I get to Manzini every month? Session in Bukwa for occupational therapist every month. How do I get there every month if I'm saying mage utengisa tamatisi anyanisi emarket and we just get by ngaleyo maleyo? So akalavumisa ngiteka manzini. Like all those issues actually contribute ukuthi le thinking alesithi thina sizamakte lapha mentally liqhubeke tiye embili and ukhanze ukuthi sekuyabhicana, if I can put it that way. Nangabe besimlaphela mhlawumbe intellectual disability kuphela sekutawungena ne-anxiety. Nangabe besimlaphela intellectual disability sekungena ne-depression, because this person is not actually accessing the services that actually make them grow and continue living their life in their fullest.
What are some of the psychological challenges that then creep in because of these, the intellectual disabilities, or also just the fear of disclosure? What are the psychological challenges then?
Psychological. Well, basically, these people face an increased risk in developing, I think it's monotonous nyalo. They actually face a risk of developing your anxiety, your negative coping mechanisms. Instead of kuti, they should be getting the help in order to cope. But abalfole tsitolelo. Umuntu hamba yo gcina bhema, agcina natha. And
that exacerbates the
that
issue
actually
itself.
makes it worse. And futhi naga pinze futhi logonye, because these people can actually be on medication labayithathago to actually help prevent or to deal with the symptoms of the disease they're living with. Ukhanze ukuthi nale medication ihambi iphele. They actually default to medication. Go purposely seeing that. So basically, all these things actually take a toll on an individual, because because I take one step forward, 3 steps backward. So all those things, they actually take a toll on the individual, or cope negatively, and at times so fall into depression, so they are progress to suicide. So funakti or rather so funaknyamalala nje angatiwa, social isolation. Yeah.
The UNESWA Mental Health Society, you are a peer support group let me say you're making a difference. But if I could ask, especially at campus level among university students, I remember a time, there was a prevalence of suicides. If bantwana labafunza ema-university ahlukene kuleli, that you would say we need groups as such. They will make the bigger difference, so that the young people are able to converse among themselves, but more so are encouraged to seek professional mental support.
Well, from the perspective of university, of being a university student before I'm the chairperson of the society.
Sure.
Well, embassy, once you get in, family says, oh, she's made it, or he's made it. Impilo lakhaya sayitaba ngcono. Kanti lo muntu usa transitiona from being paschal kwaphale batali. Guti high school bigger protected by the teachers, by the parents. Nyalo so semvasi whereby nobody cares about you.
Feels like being out in the wild.
Life is happening, and life doesn't wait for anybody. So if you are not prepared to face life head on, and you are prepared, life happens for you. You have a difficult time transitioning into that because you have expectations that are not going to be met. Life will happen, and utatkanzungeko prepared for that. So that is the transition that hits people first time. Two, kuna issue if I'm coming from an impoverished background as a university student, ngangena university kuba nanakuthiwa allowance. The allowance is made for ukuthi I can actually survive and cope in university, but instead ibuyele ekhaya iyona kabantu abakithi labancane. Ibabhadalela school fees, ngithenga ukudla ekhaya, ngibuye lamvasi I don't have anything. I cannot cope ngeclassini ngilambile, and ngicine ngibuta ukuthi okay, what's the point? Because uthi uyabuka futhi ubuka 4 years after good umsebenzi uta graduate ubuyelele ekhaya la sebaphila khona ngale allowance yakho. Allowance is 2,000 baphila ngale allowance yakho. Kusenjalo, you also have academic pressure embassy it is very, very, very high.
Okay.
Because you're from a high school system lapho khona you are being spoon fed everything. Lana kumele utinakekele. You have to be the person who is consistently there for you academically. Most of the things we have to procrastinate, strike. We focus on other things apart from the academic, more than the academic, if I can put it that way. Makfigi exam, failed courses. Failed courses you have to patalela when you continue.
So what's the remedy then for all of these? As life waits for no one, it all hits you at once.
True.
What's the remedy? What should be the coping mechanism? Briefly. Coping mechanism is that we actually sensitize the young people transitioning from high school into university, transitioning from university to life out there career-wise and everything. They should be prepared for life, prepared for the financial hardships, prepared for the academic pressure, prepared for even the difficulties and challenges of unemployment, if I can put it that way. Sure.
So as a society, siba capacitating about financial literacy skills, about academic coping mechanisms, and also just here and there. Substance use doesn't equal to fun and everything. Gotcha. So that they do not find themselves in the trap of saying they want to enjoy life and being young and everything while forgetting what really matters. That's a simvasi.
Okay, gotcha. Nonhlanhla Dlamini, chairperson of the UNESWA Mental Health Society, we're unpacking just exactly the theme of this year's Minority Mental Health Month. Who are we leaving behind? Besides that, the youth as well. We know that this is a conversation that especially matters among them. This is Kusile Breakfast Show. We're back to wrap it up quickly after this.